Audio and video from my side, please confirm. Are they
Yes, I can
clear?
hear you. I can see you.
Are they clear?
Yes.
So busy with lot of interviews, right?
Yes, sir.
So good to see you. See, I'm Dr. Naveen from UPSC MEDICO. You know me, right? I have been mentoring medical science optional students for the past 3.5 to 4 years. This is probably my fourth batch, which is passing out. And congratulations in the first place, because what you have achieved is like it's a dream come true for many, because you are on the other side of success, but I see a lot of students who struggle to make it to the list. So that way, I think I do understand the sweetness of this success more than you, right? So in that way, so how are you, Prashant? How you're feeling right now? Just brief me about your current state of mind. Yeah.
Thank you for the greetings, sir. And it's been a great journey. And also, there have been an outpouring of wishes, I should say, like across all domains, not just medicals, but even friends, family from school and vicinity, and so on and so forth. So, even across state governments, I should say. So, it's been a really new experience altogether, I should feel.
I think you're used to these kind of experiences during your MBBS too, right? So when you're sharing your photos, I could see that you have shared your photo with your chief minister, right, from Tamil Nadu. Yeah. So
Yeah.
talk us through your MBBS journey. So what was that? I have been hearing about you for the past 2 years, like how you're performing and you're into the UPSC journey and all.
Just
Just
a
brief us
second,
to
sir.
the medical science future aspirants. Like how was your MBBS and what was that, which is so special with MBBS? And when you're so fond of that, uh, how come you're into UPSC? Because that was the surprising element for many of the people who follow you, right? Yes, please.
So to start about my medical journey, I think it was in the year 2016. So I'm from the 2016 batch of Madras Medical College.
Mm.
And when it comes to medicine, I think it's more because, of course, I am passionate about medical sciences and choosing medicine as a profession. But then also, there have been quite a few health issues in my family, and that was kind of the motivating reason for me to join MBBS per se. So I happen to be the first doctor in the family, and we've had quite a few others from commerce and engineering and so on. So that apart, like in my first year, I think it was all about clearing the MBBS per se, and it's a totally new domain and niche that you are used to. So I found it quite interesting for the first year, I should say. And with respect to the second year, I think I started pursuing my interests. So I started myself into case presentations, research papers, clinical path dialogues, and I think medical debates and so on. So I used to attend quite a few conferences across colleges, and that's how I think I kept myself engrossed. So we had at least 18 months, while the current CBME curriculum batch, I don't think has that.
Yes.
So that was about second year. And then third year, I think I got myself introduced into the Indian Medical Association. So I had this opportunity to be part of the IMA as its national convener as well. And I was again part of different other organizations and NGOs, say the Students Network Organization, and then I was part of the UNESCO Bioethics Council. So quite a few organizations. So I could be part of it in the third year. And final year was all about COVID. So we were quite,
Yes.
put down into our home across the four boundaries of the wall. And probably we were just studying online. So that was how final year was. Again, internship went half into half into COVID, and probably the rest half of it was what we enjoyed. I would say maybe the night outs and those stressful emergency medicine postings,
Yes. Yes.
and probably the casualty would run, havoc on Saturdays and Sundays. So there are quite a few vivid experiences with the OT days as well. So probably we don't get to use the scrubs for another time. And this is how it was. And at the end of the graduation, so that's when probably 6 years had passed, because we were the COVID batch, and the 5.5 year tenure turned into 6 years for us.
Yes.
So
Yes.
I
It
think
was a bit
that
lengthy.
was
Yeah.
again that was again something unique with our batch. And I think at the end of the graduation day, I landed up getting 40 gold medals. So MBBS in Madras Medical College has this prestige because it is one of the oldest medical colleges, especially the second oldest medical college in the country. And also, we have quite a few endowments and prizes and medals which are conducted. So we had separate gold medal exams, which were exams for proficiency, and they used to be even on subjects like, say, rheumatology, nephrology, and so on. So we did have super specialty papers as well, and some medals used to be awarded on the basis of university exams. So that's how I garnered those medals. And that was awarded by the Honorable Chief Minister of Tamil Nadu through M.K. Stalin sir and the Honorable Health Minister through Ma Subramaniam. And it came across all the news channels. And probably that was one of the best moments in life, when you experience all the limelight across, the state and the country as a whole. It came in the Google News feed as well. So
Yeah,
there were
I
quite
was
a few
following
wishes
you down that.
pouring
Yeah.
across. That's so nice. So that was how it was in my biggest journey. And as far as the shift to civil services is concerned, I think it was more during my final to CRRI phase. And I felt that probably I was better suited for being part of the administration more so because I was already into the Indian Medical Association and quite a few activities I could coordinate with the NMC, the National Medical Commission. And as a doctor, our impact is more restricted to, say, 80 to 100 patients a day. But I believe that as a civil servant, the impact is across a million plus population. So these were quite a few motivating factors for me to enter the civil services.
Yeah, that's great. And when did you start your preparation in a full-fledged manner for UPSC? Right.
So this was exactly on August 5, 2022. So that was like 2 months after my graduation when I was done with all course which I had to do. And like I hardly had like say 8 months odd, 8.5 months to complete my MBBS, my UPSC preparation per se. So, in fact, my whole journey of UPSC, if I should say, it was more on a fast track mode. So, I kept my resources as limited as possible and try to focus on key areas where I was doing better. So, whichever was my strong area, I think I took that into my hands and probably I was, thorough about those areas, I should say. So, there were some areas I compromised, and I think it is a cost benefit ratio that matters with respect to UPSC.
Because this is your first attempt, right? Post internship.
Yeah.
I had seen in the last 4 5 years, I had interacted with a lot of toppers, and I could see that many of them who are in top 100 are actually cracking it in the first attempt. Because I can't ask you this question that how it will be if you fail, because throughout your journey you had seen the success path and you are enjoying that. And luckily, the exam is so tough. I had seen your medical science optional marks too, right? For for a doctor like you with good amount of proficiency in your field, medical science, the first doubt was what made you to shift to UPSC? That was ringing in my mind. Like I should ask this question: why Prashant is into UPSC mode? That you already answered. Second thing is the preparation part, because I could see now even third MBBS students are dreaming of UPSC. For you, it is, I think, during your final or during your internship, you have started thinking in the lines of UPSC, but serious preparation started after completion of your internship. That's what
Yeah.
that's what I got influence from whatever you have just told. So in a sense, 8 months is the standard time wherein you are able to cover the general studies plus optional, right? So, but for our aspirants who will be watching this, most of them are from the medical sciences background. For them, internship is a hectic phase, right? So, what were your preparation strategies during your internship time? Were you following any of the news or current affair related thing or GS related stuff? Just brief me through the internship period so that,
Yeah.
yeah, please.
So internship at Madras Medical College was indeed hectic, and especially during the COVID phase, since we had to pursue, it was all the more hectic, I would say. And I wasn't really able to concentrate on the UPSC civil service preparation. And in fact, probably I did, try attempting to read some areas and maybe even medical science with concern, but I don't think I was able to give attention and time into it. But then, if you ask me in retrospect, if I were to correct a mistake, probably that would be to read up, as much as possible during the uh, final year or the internship phase. I think internship phase would be the ideal time to read up both the medical sciences optional and the GS papers as much as possible in whatever meager time we get. Though there is this preparation during internship, I feel it wasn't actually full-hearted. Like I really couldn't put much time into it, more so because internship at Madras Medical College is indeed hectic, and that is one of the best medical colleges across the state. So we do have a heavy patient caseload. So that was one. And also compared to other medical colleges, because it was the COVID time and we were a multi-specialty hospital for COVID, we had quite a few cases which we humanly couldn't manage to the fullest of our capabilities. So I think there wasn't much time for us to actually study for medical science option per se or the GS papers. So that's exactly why I had to put in full wholehearted preparation only after my internship. And if you ask me if I were to make a mistake and probably correct that, that would be to take out time within internship to study as much as possible, be it for the GS papers or the medical science optional.
Yes, yes. So because I could say some of the students, they're even giving their exam during the prelims part during the internship, because this exam runs in a cycle of 18 to 24 months, right? So what were your thoughts on that? Were you prepared to give your prelims during internship, or you have decided that 23 is your the best attempt you want to give from May to September? Yeah. Yeah. Choosing the year of
One
time.
was the was the amount of time we had for preparation. So I was kind of sure that probably I would not be able to make it at the CRR attempt. And also, secondly, we finished it at a very late stage as compared to the other states. So we started a little late on our CRRA, and I think we weren't eligible for the cutoff date based on the UPSC standards as well. Like we wouldn't have got our final degree certificate by the time the prescribed cutoff was given. So I think that is probably yet another reason why I chose to take this attempt on 2023. So that was my thought process.
Yeah. Any plan B along with the UPSC? Were you parallelly preparing for the PG entrance examination, or how optimistic you are about this attempt?
I actually gave my NEET PG exams during our internship as well. Yeah, my NEET PG rank was somewhere around 9,000, and I was probably getting an anesthesia seat or a couple of other seats. But then I didn't want to choose anything. Like, again, that was totally without prep that I just went and sat and wrote. And like, there was no intention to join the PG per se because
Hello.
we were
Yeah.
actually getting 2 days of holidays for the internship. So that was actually the intention behind writing. And the plan B, of course, would have been to pursue a PG, but then it wouldn't have been at this attempt. I mean, I would have probably given at least 2 to 3 attempts before, narrowing down on going for the NEET PG. So that would have been my thought process.
Hmm. Because what happens here is when you think of plan B, most of the times I have 9 out of 10 students who also think in the lines of doing NEET PG, because we know the success rate with this exam,
Yeah,
99.9%
it's a
chances
minuscule.
that you
It's
fail.
minuscule.
So they do prepare for NEET PG, but the pattern is entirely different. I had seen many like top 100, top 1,000 students in NEET PG were unable to clear CSAT here, and people who are getting ranks like you are unable to do too well in MCQ based exams, because the approach is different, the process is different. So your
Yeah,
plan A and plan B both were UPSC, but if it doesn't come out, how many attempts were you planning like with the
maybe a
UPSC?
solid 3. It would have been at least maybe in the second attempt I would have kind of introspected, and the
Yeah.
third attempt I would have given. Yeah.
Yeah. How satisfied you are with the result? Were you expecting this or a better rank or a worse than this? So what was your thought process?
I think, in fact, more than me, my mentors were, expecting a better rank from me, and I think this rank is partly something that I ruled upon. So there were quite a few blunders that I did in the mains exam, and probably the interview score could have been slightly a little more better, and the medical science option score as well. So this is what I felt across. But quite a few papers like GS2 and 4, I was pretty sure that I'd done extremely well, and I think the scores of GS2 were 125, which totally reflected that, and GS at ethics I got 133, and I think these two happen to be very the year this time. So I think
Yeah.
that GS2 4 I've been extremely satisfied, but few other
The,
papers maybe a little more is what I expected.
yeah. The worrisome one were GS1, medical science optional, and interview is good because 190 is above par according to the average marks which I had seen. But this time people got 215,
Yeah.
216 also, right? I think. uh,
Around 212, 215. So I think that depends more on the board. Of course, there's this fortune of luck, and
yeah.
anything above 190, I think it's all about the matter of the day.
Yes, yes, yes. I could understand. So, what went wrong with your paper GS1? What was the blunder?
So GS1, I think once I saw the paper, there were quite a few questions that I was unprepared of. One was about Fords and Delhi Sultanate, and then there was one question on Purvaya as well, twins. And these were questions which I had no clue of. So think that kind of depressed me a little. And the other questions as well, I was not very thorough, well prepared about those areas. So I think a little of time to formulate my answers, and I was lacking on a little amount of time. So I think that was a major issue with GS1. And at the end of GS1, I felt it hadn't gone extremely well, or probably even average, I would say. It was a little below average, is what I felt with GS1. So I just made up a call with my mom, and then when I spoke, and she was like asking me to cheer up and probably give my GS2 and the other papers really well. And beyond that, I think that encouragement and motivation pushed me towards doing GS2 really well, and I could land up getting 125 on that. GS3, it was above average, and I think the scores reflected, so I got around 91. And for GS4 ethics, again, I felt at the end of the paper that I've done extremely well. And
Yeah.
yeah.
Now it's fine. Essay, yes. Start with the essay.
Yeah. So with respect to essay, I misinterpreted the second topic a little differently. Like there was a topic on feminism with boys with demands being half the topic, and I considered it as the demands that boys make on girls. While that was again more of the demands that were made by the society over girls. So I think I would have lost a couple of marks over there as well. And maybe interview, yes, it's in above average score, but probably maybe somewhere around 95, or even 1 mark more would have been an easy cakewalk for me. So that's what I felt about the interview. As far as the medical science option was concerned, I think around the past 2 to 3 years, we've been getting somewhere around 270s, 260, and 280s, and so on. So it's been around 260 to 280 max. This has been the range in the past 2 years, though before that, people used to get 300 and 330 even in one of the years. And I think my score happened to be 261. And I think it's more as a result of the cost benefit ratio, though paper two, I felt I really did extremely well. And I deserve to get a little more, I would say another 10 marks more or so in paper two. So maybe I think what went wrong in paper two was about the number of diagrams I drew, because I didn't draw much of the diagrams, and more often my points had the best of answers. Like I did give the dosages for drugs, and there were nuances, there were minute points that I included as part of the answer, but I think they expect diagrams in paper two. So I think that was the shortfall for paper two. And with respect to paper one, I think I really did bad, because anat and physio biochem were not areas that I was well versed. Like it's been quite some time, and I had forgotten a lot of the stuff. Like across the whole 8 months, or I think medical science would have been the least I'd prepared, because I thought I'd be able to pull up something or the other, irrespective of what the content was, and I knew probably I'll get a decent 260. So this was something I knew beforehand. And the only thing that in medical science probably I had to do was to probably improve it a little more to 270-ish, or probably max to 280. So I think that's where the shortfall was, but it's more of a result of the cost benefit ratio. And considering that I've invested less time on medical science, I think score of 261 was okay-ish, if not extremely great, considering the number of medals and all that.
Yes. See, I would like to add some of the analysis here. The reason being, I am from the medical science faculty, and what I observed this time, we got around 8 students in the 280 range, right? 280 range, and the top mark is 287 so far. And the year before that, it is 287. The year before that, it is 299. Yes, in the last 3 years, these were the marks range.
Yeah.
And yes, the one thing I always tell my students, like my aspirants, medical science aspirants, is if you start aiming for 300 plus or 320 plus in medical science, you will definitely get it. But the problem here is for a doctor to switch to UPSC with the short span of time what you have, you invest more of your time into learning new domains like general studies, CSAT, which is becoming unpredictable these days. And also, you also need to prepare for current affair related stuff. International relations are gaining a lot of importance these days, which are pretty new for us, because we're dwelling in a well wherein we only have medicine with us, nothing else, right? We don't know anything happening around the world. So that way, I think it is optimist to aim for 280. Yes, definitely. And whatever time you have invested in, I think the same thing happened to Dr. Aditya last year also. For him, he did the same thing. Like he was focusing more on the general studies. He scored well in essay and ethics like you. He's proficient. His communication skills are good. His presentation, the philosophical way, the blog writing way, the poetic way, I think they come in handy. And I tell all my students that stop worrying about medical science. The reason being, you have decided to become an administrator, not a doctor. So don't
Yeah,
try to master the concepts. Aim for good 260, 270. You will become an IAS officer. And this has been proven by even Dr. Anshupriya. She scored 261
yeah,
and
totally.
All India rank 16. Now, there is always a dilemmatic situation. What if Dr. Prashanth might have scored 300 plus in the optional? He could have been probably in the rank 10, right? Top 10 or top 15 with the medical science optional.
But I
So,
think that would have compromised my scores in the GS papers. So I
exactly.
think it was a calculated decision.
Yes, the balance part is very important, and I'm very happy that there's a live example of what I'm preaching for last 3 years. Because there is always
Yeah.
people blame optional for the reason being you can blame it because it's an optional. You can change it. Otherwise, the remaining subjects they remain static. You can't do it. You can't mess with them, right?
Actually, the
Yes.
reason why it shows medical science was more because that's the only subject that I can post my trust and faith upon. I mean, I don't have to, put my time and energy on another optional, which would probably take me another 3 or 5 months. So any new optional would take you at least 3 months. So
Yes.
I
Yes.
don't think, medical science, I would have invested probably less than a month. So that is how less I would have given for it. And considering that, I think this is a very good, decent choice. And also, people who can choose medical science, provided they are ready to, compromise on it a little bit. If they want a perfection, across all the papers, then probably that is why they lose out. And probably one mistake, which I wouldn't maybe call it a mistake, but also because of paucity of time, I never gave a medical science test paper. So I directly jumped, from my final year examinations, be the university or the medical exams. The next paper I wrote in a medical science background was the UPSC paper directly
Yes.
in the hall.
Yes. Yes.
So it took me a little time to understand which question to choose. And also, I just thought that probably I should have chosen a different question, which should have, fetched me another 5 marks or something. And I would have easily probably been able to gain 5 to 6 marks at least, choosing a different question. So that was one thing that I felt. And the time management, like paper one, it was a little tough for me to finish on time. So that's when I understood that probably I should have been trained a little in the medical science path. So I think it was okay. Like there are compromises and trade-offs that you need to do.
Yes, that's great. So I think I can conclude this part of discussion by saying that if there were 3 to 4 months extra time for Dr. Prashant, I think we could have expected at least 290 to 300 plus in the optional because yes, test series is the way I could see in the last 2 3 years. The people who are the toppers from medical science background are the ones who have finished at least their subject-wise tests with me. The reason I'm telling you is that yes, the we are never used to having choice in the medical science paper in universities. You have to write everything and you have to score good. But here there is a logic like question number 1 and 5 are mandatory, and out of 8 you have to choose 5, and there is some mathematics to it which only comes with the practice. I think the inference from this discussion is yes, definitely medical science requires more time to master it, but you're not here to master medical science, you are here to leave the medical science and go into administration. So that way the basic knowledge will give you good average 270 to 280 marks. If you work hard, you will definitely be an IAS officer, and it's proven for the last 3 years. So I think uh, balancing both GS and medical science becomes tough sometimes. I think you have to weigh GS over medical science optional, and that's what is the lesson learned from both Dr. Prashant this year and Dr. Aditya the last year. I was telling the students the same thing. So don't worry, don't always try to score 330, 340 in medical science and think that it's gonna clean sweep your rank. So that's not gonna happen. You can even rank number one who got around 1099 also scored 308 in optional, right? Like they do lot of scaling in the optional also because they want to adjust the marks range because people are coming from different domains and subjects, right? So that's what is this part of discussion is very important for the future budding doctors because they're always biased and they're spending more than 1 year to master another optional like
Medical
anthropology,
science alone
psychology,
or any other.
sociology. Yeah, they're not coming back
Yeah.
again. So that's the problem. It's taking so much of time for them to score good in other optional. Definitely, what I personally believe is if doctor is given a choice, he can even score good in mathematics. But the problem is the time management. It might take more time
Yeah.
than usual. Yeah. Chalo, Nana. So we're done with the basic understanding of how this went and all. Like it's specific strategies, like how you prepared for prelims and for doctors, CSAT is becoming very tough. What I could see is I got very good doctors who are giving best answers in the test series, but they're not writing the mains. The reason is the somehow in the last 3 to 4 years the trend is different. CSAT is becoming a little difficult. So how did you tackle that, and what were your strategies for prelims in brief, please?
So with respect to prelims, I think I just kept my resources really low. And with respect to the current affairs, I just followed a monthly, an annual compilation. Like a monthly compilation was tough to handle. Like I used to forget stuff. So I think an annual compilation is more than enough. I think revising it all over again is what you need for prelims, and some intuition with which you need to work to, understand as to how many questions to attempt and which questions to, stop writing from. So this was the basic strategy for prelims and nothing different. For CSAT, I think I was actually confident about clearing through based on the previous year's papers, and was already an NTSC scholar where we had mental ability paper.
Yes.
So I was kind of confident about it, but when I actually saw the CSAT paper, I was in for a shock. So it was way different from how it was before, and like I barely managed to answer the mathematic questions in CSAT, and I went in for English comprehension as far as possible. So I think that's the strategy to go about in CSAT. You need to practice a lot of math problems, and apart from that, English comprehension, and then you're good to go.
Yes. And what about mains? Just one to I could see many of the medical science students scorecards. I had observed 25 students so far. In GS paper 1 and GS paper 3, like not many have scored more than 100. Is there any specific reason this year, or it's a usual trend?
No, GS1 actually used to be a very scoring paper where people used to get around 100 plus, but this year there's been some level of scaling with respect to GS1 and 3, and GS3 over the past 2 years as well, there's been the scaling. So I think the median score has been in GS1 this year somewhere around 80 to 90, or even 75 to 90, I would say. And with respect to GS3, it's been somewhere around 80 to 85 to 95 again.
Yeah.
So I
What were
think
your
for that basis, it's fine.
what were your resources and strategy for SA to GS4?
For GS4, sir, or
Overall, from
ethics?
starting from SA to GS4,
Okay.
if you want to tell the future budding
Yeah.
aspirants who are giving exam next year, like what would you recommend them
For,
to go through?
for the essay, I think it's all about scripting a good anecdote and just connecting the anecdote with the conclusion. So it's like a basic essay that you need to prepare with the intro, body, and conclusion, and all the points added to it. Like there's nothing different about it, just that you can probably give different references. I think it's the way you carry forward the essay that matters, in scoring for the essay paper. And as far as the GS1, 2, 3, 4 are concerned, I think for one, I kept my resources the same. Modern India, you go for Spectrum. And for the mains related part, probably I went for the mains 365 series that are released. So I used to read the textbook part along with the mains, series which were released. So this was the major thing for my answer writing practice. And every answer I think needs to be in points with suitable diagrams if needed. But if that adds to a value addition, merely putting up a diagram, I don't think helps in GS. And when it gives to writing conclusions and intro, something with the stat, an intro based with a current affair, and something that you can link it with the relevance of the question. I think these are pointers that obviously will raise your score. So that was about intro, body, and conclusion. For GS2, I think I followed the main series along with the standard textbooks, and for GS3 again the same. Nothing different for GS1, 2, and 3 with respect to the resource. So for the GS4 paper, I think it's all about taking up definitions from lexicon. So that's what I did. And for the examples part, I used to go for the topper copy answer script. So I think they've done a better job, in collecting examples, and we can be no better than them in doing that over a short period of time. So I think that was my go-to resource for ethics. The better your examples are, the different they are, I think that carries more marks. So that was my methodology for ethics paper as well. For medical science, I think I did refer to the textbooks, but I ensured that I had small hints for it, jotted down on the side of a paper so that, I could probably recollect and write them with better accuracy. I think that's what matters with respect to the medical science paper. However accurate you are, the dosage that you write about a particular drug, and probably the management which needs to be about medical, surgical, and the general management about the psychiatric component of it all you can address about. So I think these were specifics, and maybe one drawback was about the diagrams because I didn't draw quite a few diagrams. So maybe that was about why I got a little less in medical science. So I think diagrams and flowcharts will do a better job.
Yes. About the personality test, like how were you preparing for the interview and all? Did you attend mock interviews? Have you been to Delhi? So how was the preparation phase for that?
Yeah, I've been to quite a few mock interviews, and most of them were in my place at Chennai. And I did get the opportunity to be there at Delhi as well. Like I just came some 3 4 days before the actual interview, and I gave quite a few mocks. And most of the mocks had very good feedback. So it was somewhere around 190 plus for sure. And I think that suits your temperament as well. In a personality test, it's about part personality, as in your CV matters, as in the DAP too, and also your way of answering. I think they expect you to show confidence, the way you talk and the way you carry yourself out. So the more it is akin to an administrator, the more proportional the score is. And of course, there is this understated role of fortune, luck, and the type of board that you get that matters as well. So some boards are known to be conservative and some boards are known to be liberal, and that is not something that is in our hands. So I think that is best left to the Lord and for us to choose. So I think for the interview, it's all about following current affairs, maintaining your CV, doing your job well, and attending mock interviews.
Yeah. So it's very important that you do attend some of the mock interviews and yes, proceed further.
Yeah,
And
definitely. Because that grooms you to get at least a 190 plus.
yeah, if suddenly some of your friend calls you and asks you what is your real motto behind UPSC, because now you are into IAS, what do you want to achieve in the future? What was the driving force
So
to
I
get
think,
into the services? Yeah.
yeah, so I think I've also been a first-hand person to see how the CM scheme for health insurance works, and also the Ayushman Bharat, because as interns we do make papers to the same. And I think the impact that such schemes have been able to be made over a million plus population, that is not something that as doctors we'll be able to achieve. Like we do speak of change, and as this quote by Gandhiji where he says, be the change that you want to see in the world. So I think that's exactly what I also wanted to visualize. And being a part of different organizations and handling administration at that level, I think I wanted to expand my horizon. So this was the bottom line behind me and venturing into this.
Mm-hmm. IAS or IFS or IPS?
The IS, definitely.
Yes. And one more important thing is, uh, yes, the switch happened. Now you're into UPSC, right? Will you be missing the medical part? And what were your medical science related interview questions? What did they ask you? Because you're a doctor there, right?
Yeah. So of course, there is this feeling of missing the medical profession, but then there are our own friends, juniors and seniors who talk about different cases and their experiences. So I think I still stay in touch with the medical fraternity that way. And even as a sub collector or as a district collector, you are in charge of the health parameters of the particular district as well. So I think it's always an everlasting relationship with medicine, probably until the end. And also, as far as the questions in the interview were concerned, it was more related to anemia. So I was also part of the Indian Medical Association. So they asked me about the activities of the IMA and how they work. And with respect to anemia, I spoke about the interventions as well. And they asked me about, why the prevalence of anemia has been increasing in respect to of, such interventions as compared to vis-a-vis NFHs 5 and 4. So apart from that, there was this question on NEET, the NEET exam per se, and Tamil Nadu is a position to NEET. And also the brain drain of medical students, because there are students who venture into the United States, Philippines,
USMLE, yeah.
Vietnam, and so on for medical science. So Ukraine rather. So there was this question on this as well. And the advancements in the medical field. So these are the questions that us.
Yeah, because sometimes what happens, like they'll definitely drill on in your case, it was National Iron Prophylaxis Program, right? In a different, every year I could see most of the toppers, there were some national health programs which were touched upon, not the hardcore medical related drug dose kind of questions. So definitely they're not going to ask that.
Yeah.
Yeah. Have you done any special preparation for medical science interview related stuff?
I think I just looked up the questions which have been asked in the transcript for different medical practitioners. So those have been a reference model for me. And also in the past years, there have been some topics which they've touched upon. So I just had a knack of these topics and I looked them up. So if there was some current affair updates with respect to medicine, like say Supreme Court judgment which came in between saying that Irish practitioners will not be paid the same stipend as medical practitioners and MBBS. So these were some new things that I looked up. If there was something new with respect to the Nobel Prize in Medicine, something on those lines.
Yes, yes. So you're talking about the mentors, right? You're talking to them and all. Would you like to or talk about them, the coaching help or the mentorship? Yeah.
Yeah, definitely. I think guidance is pivotal, especially in this journey. And there have been quite a few serving officers who helped me as well. And Dr. Madan IPS, who happens to be the Tanjore ASP. Then I had Rohit Nadan sir again, who happens to be an IPS. So they've trained me a lot for the interview. And Rohit sir's, interview training is one of the best that people need to take up. And there was Dr. Chintanandi ma'am as well, who again, is a surgeon by profession, and she's an IRS who helped me a lot in this journey. So I think these three mentors have been really helpful. And apart from that, certain coaching institutes as well, smart work labs, did help me with respect to the interview part, and as well for the other areas as well, say prelims, mains. I've been in touch with RMIAs and then officers IAs. So money the name and the government academy as well, because they gave us these scholarships, then Kingmakers. So I've taken up mock interviews from quite a few institutes of these. So I think uh, that is a great portion for different academies and part of the success.
That's good. So students from Tamil Nadu shouldn't be getting on the flights or trains of Delhi to train, right? You have enough resources there to do well because that's the
Naturally,
usual
it's a
case.
globalized world.
Yes, yes, from Tamil Nadu. Good, Prashant. And yeah, what is the secret of success in single sentence? If you want to give the credit to, yeah, what's your
I
secret?
think smart work and consistency, that's what matters. Like even if one attempt flunks, I think you need to give a second attempt. And when it is about consistency, I think even if you bunk a day, I think the other day needs to work out on full mode. So it's okay if you study even 1 hour, it doesn't matter. But I think it needs to be quality work that you do in that 1 hour. So it's all about consistency and smart work.
Yes. If a final MBBS student or an intern from medical science background, if he's looking upon you, like, what is the best tip that you give them?
I think they need to start early in the preparation. So probably I chose to do it after internship, and if they do it even way before that, I think they have an edge. So that's what matters, I believe, totally with respect to being, with respect to UPSC or the medical sciences optional as a whole.
Yes. Start early and stay consistent. So, any final conclusion words and what is the plans for the next few months?
So I think for the next few months, it's all about chilling and enjoying the moment. So there's always been this transparency moment already, and people have been at your back. So this is
Yes.
not something that you get very often, and I think it's about enjoying the moment. So post that, I think all of us will join the training, and maybe once we join the civil services, I think I wish to work on health and education.
Mainly in the health sector. Yes, yes. Good, Nana. Good. It's very nice talking
Yeah,
to you, Prashant, and I'll be looking forward for your help in the interview related stuff. Maybe a 30 minutes of time to interact with students
definitely.
from 24 batch who will be attending interviews. Because last year when we conducted
Yeah,
interview guidance program, you're part of that group, right? We were conducting it with the previous year toppers.
yeah, yeah.
Dr. Anjaliga came and
Yes,
yeah, so we'll be doing the same thing the upcoming year, and I request from UPSC Medico that you
sure.
should be a part of it and you should guide the future doctors to get into the civil services, right? So all the best for the future. It's very nice
Yeah.
talking to you. Jai Hind.
Thank you so much.
Yes.
And it'll be my honor and pleasure to be part of the team.
Yeah,
Thank
I'll
you so
ask
much.
a personal question. So what is this
Yeah.
uh, uh, spirituality? Like I could see your status suddenly, you're posing Lord Shiva photos and all. You have been to the different temples because I love to travel in Tamil Nadu and visit a lot of
Yeah.
temples. If you're from a cadre of Tamil Nadu, I'll definitely ping you when I come there.
You should definitely.
Yeah,
You
I'm
should
planning. I'm
definitely
planning.
and be our guest.
Yes. So what is
Yeah,
this?
definitely. You should be our
Spiritual.
guest. And I think, yeah, there is a visible role of spirituality as well in this preparation, more so because I think it's a matter of faith. And that faith needs to be not just on you, but also on the, I would call it probably the spirit that exists in the world, which you cannot probably give it a form, a name, or call it, anything. It could be confidence, it could be energy, it could be spiritualism. You name it, it is what it is. And I think it is that thing, that force which propels you to achieve your aim. So at the end of the day, it's all about, as how Paulo Coelho quotes in The Alchemist, that the world conspires inspires for you to, achieve your aims. If
Yeah.
you are persistent and stubborn about your particular aim. So I think that's what I achieved. And it was more of a Thanksgiving or a gratitude session that I.
Very good that you're also giving thanks to the Almighty, like which you believed in, and I felt very happy. Jai Hind. Hopefully, we'll meet again. Okay, through
Yeah,
online mode, or if you
yeah,
choose
sure.
cadre, I'll definitely meet you personally once you are back from your
Definitely at least.
training and all. Okay, nice talking to you, Nana. Take care. All the best.
Yeah, sure. Yeah. Thank you so much.
Yes.
Pleasure.